All right, it's the question we asked you right before the break. What do alcohol abuse, smoking, and a lack of social relationships all have in common? They have close to the same amount of risk directly linked to mortality and premature death.
Huh. Wow, that's depressing.
I know.
Loneliness is one of the biggest health problems facing us right now. Dr. Damon is back to talk about that. Good to see you.
Good to be here. Thanks for having me.
That's scary there, I'm sorry.
This affects men more than women?
No, it affects everybody.
Equally?
I mean, there was one of the studies that looked specifically at men, but really, there was a recent analysis, looked at 150 studies, so over 300,000 individuals for different risk factors. And what they found is that those that had a strong social relationship were 50% more likely to have survival.
And why is that? Because they have people saying you need to go to the doctor?
I think there's a variety of factors. I think one is that there's a psychological stress that occurs with isolation. The same thing can occur with loneliness, two different things. And those stressors build inflammation in the body just like everything else. So that's heart disease. We've seen it with heart disease, we've seen it with stroke, we see it with Alzheimer's. We've seen it across the board that they are a huge risk factor.
So inflammation is really a key marker in a lot of diseases.
Absolutely. And
whether it's through diet or stress.
Yeah. What we found, we're surprised that it's actually a higher, social isolation is a higher risk factor than obesity, than smoking, than some of these other things that we talk a lot about. So in this digital age where we are often isolated, so we've seen a huge shift kind of since the late 90s in what this is doing to us. This idea of social connectivity not just being influential for psychological health, for emotional health, but for our physical health is huge. I mean, there was another interesting study where what they did is they took a group of people, 3 folks on a commuter line, and they said, one group, you have to engage people. Another group,
face-to-face.
Face-to-face, you need to start conversation.
Human interaction.
The other group, you go sit in a corner, don't talk to anybody. And the third group, just do you. You do what you do. And they asked them beforehand, who's going to be the most miserable group? And everybody said the group that's got to start conversation.
Really?
And at the end,
they were the happiest.
They were, of course. They were the happiest. They had the best trip.
Because there's fulfillment in conversation.
They had all of that. So that's a fun way of looking at it. But I think, I see on a daily basis as I talk to people, whether it's a stay-at-home parent or somebody who's working in a cubicle, anybody who feels like they're trapped in their space, that they miss that, hey, the reality is this is hard for all of us. And how much better is it when we're able to connect over that? Not just the hardness, but the joys.
So are these things killing us then? If we, especially young people, whose eyes and lives are affixed to this more hours than they are having interpersonal communication, what is that doing to us?
So I would say those that spend, there was a study that 19 to 32-year-olds, if you spent more than 2 hours on your phone doing social media a day,
which is what most people do.
Those people had 2 times double the risk of social isolation and loneliness.
Wow.
Which then, as we now know, that also starts to do this inflammation and create all these other risk factors. It's not just about mental health, which it is huge about mental health, but there is, when we're on there, it's affecting our physical health.
Wow.
Yeah.
So what do we do? Because everyone's lives pretty much are tied, especially young people, and we haven't seen what that's going to happen to the health as we get 10, 20, 30 years down the road.
Yeah, I think one is if we recognize that we're designed to live in community. Right. When I think about health, it's related to how we eat, how we sleep, how we move, how we hydrate, how we create, how we relate to one another. As we make that a priority, that begins to change the way that we interact during our day. So simple things, you think about the line at the coffee shop or the grocery store, everybody's sitting there looking on their phones waiting for that. It wasn't
Not
that way.
Me. I'm the
10,
annoying
15 years
person
ago.
who's trying to talk
That's
to
right.
you.
Everybody thinks they're the annoying person, but I had a great experience yesterday at the grocery store. I had self-chosen the self-checkout line, another bit of technology that allows me to not speak to anyone. And then I get up in the line, doing my thing. Guy next to me says, "Hey, where'd you get that shirt? I really like that shirt." We have an interaction, a conversation, super simple, but I left there feeling a lot better about myself. That changes the trajectory of your day, not just your mood, but then that also has effects on you physically.
Dr. Damon Heybrock, a great guy, great person, also a great doctor. You can be a client of his it's a monthly fee. You do it a little bit differently. Explain that real quick.
Well, I agree that conversation is a big part of your health relationship too, and that's what we do. Is we create space and time, access with a doctor that you can have a relationship with. It's a monthly membership, and that gets you access to me. So I'm
24/7.
You betcha.
All right,
Scary.
thank you, Damon. By the way, his place is at 47th and Westwood. Really cool office. You can find more information at healthstudiokc.com.
Thank you, Dr. Damon.
Thanks for having me.
All right, our coverage of